Swayam Prabha. Digital India. Educated India.
Hello friends, today we will be talking on the parotid gland. I am Dr. Daksha Dikshit, Professor of Anatomy, Jawaharlal Nehru Medical College, KLE Academy of Higher Education and Research, Belagavi. Let us start with a clinical case scenario. A 12-year-old boy presented to OPD with a complaint of rapidly growing painful swelling on the right side of the face in front of the ear. The pain increased while taking meals but reduced after finishing the meal. On clinical examination, the physician found the right ear lobe lifted. Oral cavity examination revealed congestion of the mucous membrane of vestibule of the mouth opposite the upper second molar tooth of the right side. Based on these, the diagnosis given was acute parotitis of the right side. Let's keep this case scenario in mind so that we understand why these symptoms developed and how the diagnosis was done. We will be discussing the parotid gland under these following headings: introduction, situation, size, shape, weight, extent, capsule, morphology, which is the apex, borders and surfaces, relations, parotid duct, structures piercing the gland, blood supply, which will include the arterial supply and the venous drainage, lymphatic drainage, nerve supply, and finally we will do the applied anatomy. Introduction. Parotid gland, para-otic, around the external auditory meatus. The parotid gland is the largest paired salivary gland. It's a compound serous type of salivary gland. It is situated below and in front of the external acoustic meatus. That's what we've already said, para-otic. It's a size of a walnut. The shape is inverted pyramid shaped and it weighs about 20 to 25 grams. Let us see the boundaries of the parotid region. The parotid region anteriorly extends up to the ramus of mandible. Posteriorly, it extends up to the mastoid process. Superiorly, it is limited by the zygomatic arch, the external acoustic meatus and the capsule of the temporomandibular joint, and medially it extends up to the styloid process of the temporal bone. Let us now see the extent of the parotid gland. The horizontal extent of the gland: anteriorly the gland extends up to the middle of the masseter muscle, while posteriorly it extends up to the anterior border of the sternocleidomastoid muscle. Vertical extent of the gland: superiorly it extends up to the external acoustic meatus, whereas inferiorly the extent is up to the upper part of the carotid triangle 2 centimeters below the angle of the mandible. We now study the capsule of the parotid gland. The parotid gland has two capsules, an inner true capsule and an outer false capsule. The inner true capsule is formed from the condensation of the connective tissue stroma, while the outer false capsule is contributed by the investing layer of deep cervical fascia. This external capsule or outer false capsule shows superficial lamina and a deep lamina. The superficial lamina is thin and covers the superficial surface of the gland and is also known as the parotidomasseteric fascia. The deep lamina is prominent below, while if you trace it superiorly, it fades away or thins out in the upper part. It is attached to the tympanic plate and the styloid process. It also related or contributes to formation of the stylomandibular ligament. Stylomandibular ligament is a modification of the investing layer of deep cervical fascia, extends from the styloid process and goes up to the angle of mandible. The stylomandibular ligament separates the parotid gland from the submandibular gland. Let us study the morphological features of the parotid gland. As we have already said, the parotid gland is inverted pyramid shaped. It has got apex which is pointing downwards. The base is also the superior surface and the other three surfaces are the outer superficial or lateral surface, and on the inner side there are two surfaces, that is the anteromedial surface and the posteromedial surface. It has got three well defined borders: the anterior border which is there between the superficial and the anteromedial surfaces, the posterior border which separates the superficial and the posteromedial surfaces, and the medial border which separates the anteromedial and the posteromedial surfaces. This picture shows us the morphological features of the parotid gland. What we see here is the outline of the parotid gland. It is obvious that it is an inverted pyramid shaped structure. The inferior part is the apex pointing downwards. The uppermost will be the base or the superior surface. Anteriorly, the parotid gland extends up to the mid part of the masseter muscle, whereas posteriorly it extends up to the anterior border of sternocleidomastoid muscle. What is also seen here is the parotid duct which emerges from the anterior border and travels over the masseter muscle. Accessory parotid gland. Accessory parotid gland is seen in 20% of cases. This is nothing but small detached part of the gland, also known as the pars accessoria or the fascia parotidic. When present, these accessory parotid gland or the glandular tissue lies between the zygomatic arch and the parotid duct. This picture here shows us the parotid gland, the parotid duct coming out from the anterior border and travelling over the masseter muscle, and over the parotid gland we see a small detached part of the glandular tissue which is the accessory parotid gland. At times there may be glandular tissues apart from the main parotid gland which are then called as the processes of the gland. What are these various processes which we can come across? Facial process is a triangular projection extending forwards superficial to the masseter muscle along the parotid duct. Next is what we have already seen, an accessory parotid gland and its duct. This is nothing but a small part of the facial process detached from the main gland and is situated between the zygomatic arch and the parotid duct. Next is the pterygoid process, a triangular process extending forwards from the deep part of the gland between the ramus of mandible and the medial pterygoid muscle. Next we have the glenoid process. This passes upwards between the external acoustic meatus and the capsule of temporomandibular joint. Next, we will study the pre and the post styloid processes. At times, the styloid process lodges in a groove of the glandular tissue. In such cases, the gland in front of the groove is known as the pre-styloid process, which is related to the internal carotid artery, while the part behind the gland forms the post-styloid process, which is sometimes related to the internal jugular vein. These were the various processes of the gland. We now go on to study the relations of the parotid gland. The apex is directed below or downwards and overlaps the posterior belly of digastric muscle and appears in the carotid triangle. Structures passing through the apex would be the cervical branch of the facial nerve, the anterior division of retromandibular vein, and the formation of the external jugular vein. The same is seen here in this picture. We see here the parotid gland. This lower part of the gland is the apex. Structures which are seen at the apex: the cervical branch of the facial nerve, the two divisions of the retromandibular vein, the anterior division and the posterior division of the retromandibular vein. We then go on to study the relations of the surfaces. The superficial surface. Superficial surface is related to the skin, superficial fascia with posterior fibers of platysma, superficial lymph nodes, great auricular nerve which supplies the skin over the angle of the mandible, parotidomasseteric fascia with the deep parotid lymph nodes. Thus, there are two groups of lymph nodes related to the superficial surface. The great auricular nerve supplies the skin over the parotid gland, especially the skin over the angle of the mandible. The superficial lymph nodes seen here drain the side of the face and the pinna. Deep parotid lymph nodes will drain the lymph from the nasopharynx, the auditory tube and the eyelids. This picture shows us the cross section through the parotid region. What we see here is the parotid gland. This surface is the superficial or the lateral surface. This is the anteromedial surface and this is the posteromedial surface. The three borders, the anterior border separating the superficial from the anteromedial surface, the medial border separating the anteromedial from the posteromedial surface, and the posterior border separating the superficial surface from the posteromedial surface. What we can see here are the relations of the superficial surface: skin, superficial fascia and the deep fascia, which is here known as the parotidomasseteric fascia, along with the two groups of parotid lymph nodes. We then go on to study the relations of the base or the superior surface. The superior surface is related to the structures in anterior to posterior direction, that is the temporal branch of the facial nerve, the superficial temporal artery and vein, the auriculotemporal nerve, the mandibular fossa, that is the non-articular part of the mandibular fossa, and the external acoustic meatus. The same is seen here in this picture. This upper border or the superior border, the base of the parotid gland. This picture shows us the relations of the superior surface or the base. From anterior to posterior, structures seen here are the temporal branch of the facial nerve, the superficial temporal artery and vein, the auriculotemporal nerve and the external acoustic meatus. All these structures are related to the base or the superior surface of the parotid gland. We then go on to see the relations of the anterior border. The anterior border is thin and rests on the masseter muscle. Structures leaving the gland from the anterior border or relations of the anterior border are zygomatic branch of the facial nerve, transverse facial artery, which is a branch of the superficial temporal artery, upper and lower buccal branches of the facial nerve, the parotid duct which lies between the upper and lower buccal nerves, mandibular branch of facial nerve, cervical branch of facial nerve, and emergence of the divisions of retromandibular vein at the apex. The anteromedial surface is deeply grooved by the ramus of mandible and is related to the ramus of mandible and two muscles attached to it, one on the outer side which is the masseter muscle and the other on the inner aspect which is the medial pterygoid muscle. This picture shows us the structures emerging from the anterior border. Those are the temporal branch of facial nerve, the transverse facial artery which is a branch of the superficial temporal artery, branch of the facial nerve, the upper buccal branch of the facial nerve, the parotid duct, the lower buccal branch of the facial nerve, the marginal mandibular branch of the facial nerve, the cervical branch of the facial nerve, and the two divisions of the retromandibular vein at the apex. Thus, it is clear from here that all the 5 terminal branches of the facial nerve, that is the temporal, zygomatic, upper and lower buccal, marginal mandibular and cervical branch, are all radiating or leaving the gland through the anterior border. Let us now go to see the relations of the anteromedial surface. This picture shows us the relations of the anteromedial surface. This is the anteromedial surface which is grooved by the ramus of the mandible. This surface is related to the ramus of mandible and the two muscles which are attached to the ramus of mandible. On the outer side, it is the masseter muscle, whereas on the inner surface, it is the medial pterygoid muscle. Let us see the same thing in another picture. This again is a cross section through the parotid gland. What we see here are the 3 surfaces, the superficial or the lateral surface, the anteromedial surface and the posteromedial surface. This is the anterior border, this is the medial border and this would be the posterior border. Relations of the anteromedial surface. The ramus of mandible with the masseter on the outer side and the medial pterygoid muscle on the inner surface. We now go on to study the relations of the posteromedial surface. These structures are also called the structures forming the parotid bed. These are the mastoid process with 2 muscles attached to it, that is the sternocleidomastoid on the outer surface and the posterior belly of digastric on the inner aspect of the mastoid process. The stylomastoid foramen, the styloid apparatus, non-articular part of the mandibular fossa, spine of sphenoid bone, foramen spinosum, foramen ovale and the scaphoid fossa. Deep to these structures, this surface is related to the internal jugular vein, the internal carotid artery, and between these two are seen the last 4 cranial nerves, that is the 9th, 10th, 11th and 12th cranial nerves. Structures piercing the posteromedial surface. The facial nerve pierces the posteromedial surface in its upper part, while the external carotid artery pierces the posteromedial surface in its lower part. This surface at its lowermost end also shows emergence of the retromandibular vein. We have the picture showing us relations of the posteromedial surface. This is the posteromedial surface related to the mastoid process and two muscles attached to it, sternocleidomastoid on the outer side and posterior belly of digastric on the inner aspect. Also related to the styloid apparatus, and deeper to this is the internal jugular vein which lies posteriorly. Anterior to it is the internal carotid artery, and between these two are the last four cranial nerves. So, these are the relations of the posteromedial surface. Let us see one more picture which shows another clearer view of the relations of the surfaces of the parotid gland. This again is a cross section passing through the parotid gland. This is the superficial or the lateral surface. This is the anteromedial surface. This is the posteromedial surface. So, this becomes the anterior border, the posterior border and the medial border. Relations of the anteromedial surface: ramus of mandible with masseter on the outer side and medial pterygoid on the inner side. Posteromedial surface related to the mastoid process, sternocleidomastoid on the outer aspect and posterior belly of digastric on the inner aspect. More deeper, it is related to the styloid apparatus, the internal carotid artery, posteriorly the internal jugular vein, and between the two would be the last four cranial nerves. What is also seen in this picture are the structures which pass through the parotid gland. The three structures predominantly which pass through the parotid gland are the facial nerve, the retromandibular vein and the external carotid artery. The facial nerve is the superficial most structure here. Deep to it is the retromandibular vein and deepest is the external carotid artery. We now go on to study the relations of the posterior and the medial border. The posterior border rests on the sternocleidomastoid and it is related to the posterior auricular branch of the facial nerve and the posterior auricular vessels. The medial border separates the anteromedial and the posteromedial surfaces. Sometimes it comes in contact with the wall of the pharynx and is also called as the pharyngeal border. Let us see the structures emerging from the posterior and the medial border. Here we see the structures emerging from the posterior border, that is the posterior auricular nerve and the posterior auricular vessels, whereas related to the medial border is the wall of the pharynx. We will now go on to see the structures piercing the parotid gland. From outside inwards, these are the facial nerve and its terminal branches, the formation of the retromandibular vein, the external carotid artery and its terminal branches, and the deep parotid lymph nodes. This picture here shows us the external carotid artery. The external carotid artery enters the gland by passing through the lower part of the posteromedial surface, and within the gland it divides into first the posterior auricular artery and subsequently it divides into its two terminal branches, that is the maxillary artery and the superficial temporal artery. The superficial temporal artery further gives one of its branch, that is the transverse facial artery within the substance of the gland. So, that is one of the structures, the deepest structure which is present inside the parotid gland. Next is the retromandibular vein. The superficial temporal vein enters the gland, receives one of its tributaries, that is the transverse facial vein, and later joins with the maxillary vein to form the retromandibular vein. The retromandibular vein then divides into its two divisions, that's the anterior division and the posterior division, which leave the gland near the apex. The third structure which is present inside the gland is the facial nerve. The facial nerve is the most superficial structure present inside the gland. The facial nerve enters the gland by passing through the upper part of the posteromedial surface. Let us trace the facial nerve in the gland. The facial nerve leaves the skull by emerging from the stylomastoid foramen, which is 2.5 centimeters deep to the middle of the anterior border of mastoid process. The nerve passes downwards and forwards for about 1 centimeter and then it enters the gland through the upper part of the posteromedial surface. It runs forwards for 1 centimeter superficial to the retromandibular vein and the external carotid artery. Later, it gives rise to two trunks, that is the zygomatico-temporal and the cervicofacial trunks. Within the substance of the gland, the zygomatico-temporal trunk divides to give rise to the zygomatic branch and the temporal branch, whereas the cervicofacial trunk divides to give rise to the buccal branch, the marginal mandibular branch and the cervical branch. The buccal branch later divides to form the upper buccal and the lower buccal branches. Thus, all the 5 terminal branches of the facial nerve are given out within the substance of the gland and then they emerge out or leave out from the gland along the anterior border of the gland. So, these 5 branches of the facial nerve, the temporal, zygomatic, buccal, that is upper buccal and lower buccal, marginal mandibular and cervical, are seen as radiating like the goose feet, and thus this pattern is known as the pes anserinus. The gland is thus divided into superficial and deep parts or lobes by the branches of the facial nerve. The lobes are connected by isthmus of glandular tissue. The gland appears H-shaped in coronal section. This helps the surgeon to remove the parotid tumor, leaving the nerve intact. The facial nerve also receives proprioceptive impulses from the muscles of mastication. This picture shows us the facial nerve within the substance of the parotid gland. Here we see the nerve entering the gland and its course in the substance of the gland. Another picture showing us the entrance of the facial nerve and how it divides into the two trunks, the zygomatico-temporal trunk and the cervicofacial trunk. And then these trunks further dividing into the terminal branches of the facial nerve, that's the temporal, the zygomatic, the buccal which divides into upper and lower buccal, the marginal mandibular and the cervical branches. So, these radiate like the goose feet, giving rise to the pes anserinus type of pattern. We then go on to study the retromandibular vein in the gland. Formation and course. Union of the maxillary vein and the superficial temporal vein give rise to formation of the retromandibular vein. This vein is formed within the substance of the parotid gland, deep to the facial nerve and superficial to the external carotid artery. The retromandibular vein runs vertically down up to the apex of the gland, and there it divides into its two divisions, that is the anterior division and the posterior division. The anterior division leaves the gland near the apex, joins with the facial vein to form the common facial vein, which ultimately drains into the internal jugular vein, while the posterior division leaves the gland, joins with the posterior auricular vein to form the external jugular vein, which ultimately drains into the subclavian vein. Let us now go on to see the parotid duct or the Stenson's duct. Course. It is about 5 centimeters long and 3 millimeters in width. It leaves the gland through the anterior border. It travels between the upper and the lower buccal branches of the facial nerve. It runs forwards over the masseter muscle, and at the anterior border of the masseter muscle, it pierces inwards and goes deeper by passing through the buccal pad of fat, the buccopharyngeal fascia and the buccinator muscle. These can be remembered as the 3 B's: the parotid duct piercing the buccal pad of fat, buccopharyngeal fascia and the buccinator muscle. Later, it passes obliquely forwards between the buccinator muscle and the mucous membrane of the cheek. It ultimately opens in the vestibule of the mouth on a papilla opposite the upper second molar tooth. The oblique course of the submucosal part of the duct acts as a valve and prevents inflation of the duct during violent blowing. This picture shows us the gland and the parotid duct. We see here the parotid gland, and this is the parotid duct, which leaves it via the anterior border, travels on the masseter muscle, and at the anterior border of the masseter, it goes deeper by passing through the 3 B's: buccal pad of fat, buccopharyngeal fascia and buccinator muscle, and then has an oblique course up to its opening at the upper second molar tooth. This picture shows us a transverse section through the oral cavity to show us the course of the parotid duct. What is seen here is the parotid gland, and the duct which leaves the parotid gland travels anteriorly over the masseter muscle. At the anterior border of masseter, it goes deeper, pierces the buccal pad of fat, buccopharyngeal fascia and the buccinator muscle. Subsequently, has an oblique course through the buccinator and below the mucous membrane of the cheek, and ultimately opens at the papilla opposite the upper second molar tooth. The same is seen here in a transverse section. Parotid duct going through or piercing the buccal pad of fat, the buccinator muscle and the buccopharyngeal fascia, and then having an oblique course and ultimately opening opposite the upper second molar tooth. Let us now go on to study the blood supply and the lymphatic drainage of the parotid gland. The arterial supply of the parotid gland is done by the external carotid artery and its terminal branches. The venous drainage is taken care of by the maxillary, superficial temporal and the retromandibular veins. The lymphatic drainage of the parotid gland is done by the superficial and deep group of parotid lymph nodes, the lymph ultimately terminating into the jugulodigastric group of deep cervical lymph nodes. We move on to study the nerve supply of the parotid gland. Parotid gland has secretomotor, sensory and sympathetic nerve supply. The secretomotor nerve supply reaches the parotid gland via the auriculotemporal nerve after relay in the otic ganglion. The sensory nerve supply is done by the auriculotemporal nerve and the great auricular nerve. The auriculotemporal nerve carries general sensations, while the great auricular nerve carries sensations of pain, particularly those related to the parotid fascia. The sympathetic nerve supply is done by the sympathetic plexus, which is seen around the external carotid artery, and these fibers are vasoconstrictor in nature. Let us study the secretomotor pathway of the parotid gland. These fibers begin as the preganglionic fibers from the inferior salivatory nucleus situated in the medulla oblongata. From there, the fibers enter or pass through the ninth or the glossopharyngeal nerve. This nerve further gives a branch which arises as the Jacobson's nerve. It passes through the tympanic canaliculus and reaches the tympanic plexus. From here, the preganglionic fibers continue as the lesser petrosal nerve, which passes through the foramen ovale and reaches the otic ganglion, where the fibers relay, and the postganglionic fibers will then pass via the auriculotemporal nerve and reach the parotid gland. This here shows a picture which is depicting the otic ganglion. Another picture which shows the pathway of secretion for the parotid gland. Here we see the open part of the medulla oblongata, which has the inferior salivatory nucleus. Fibers from here travel through the glossopharyngeal nerve, leaving through the jugular foramen, and then the nerve gives out the tympanic branch, which passes between the jugular foramen and the carotid canal and forms the tympanic plexus over the promontory. Further continues as the lesser petrosal nerve, which leaves via the foramen ovale, reaches the otic ganglion, relays in the otic ganglion, postganglionic fibers going as the auriculotemporal nerve and reaching the parotid gland. This is the secretomotor pathway for the parotid gland. Let us now go on to study the applied anatomy aspects of the parotid gland. Parotid swellings. These swellings are very painful due to the unyielding nature of the facial capsule. It also causes difficulty in opening the mouth. The gland may be inflamed by retrograde bacterial infection from the oral cavity via the parotid duct. Mumps is a viral infection of the parotid gland, causes inflammation and swelling, severe pain which worsens during chewing, also causes inflammation of the parotid duct with redness of the parotid papilla in the oral cavity. This swollen gland characteristically does not suppurate. Mumps infection doesn't show collection of pus. Acute inflammation of the parotid gland, also known as acute silendinitis. Pain in the preauricular region. This is because of the auriculotemporal and the great auricular nerves. This pain is more at the meal times. Next we study the parotid abscess, bacterial infection localized in the parotid gland giving rise to localized collection of pus. This abscess is drained by the Hilton's method by taking a horizontal incision through the gland in order to avoid injury to the facial nerve. Next we see parotidectomy. 80% of all salivary gland tumors occur in the parotid gland. Most of these are benign and often require surgical excision. Mixed parotid tumors. These are slow growing, benign, painless tumors which do not involve the facial nerve. Thus, while removing the parotid gland, the facial nerve is retained. The nerve is traced from behind. Supra and subfacial gland is removed. Parotid tumors in the deep lobe. This presents as a swelling in the lateral wall of the pharynx. Examination of the oropharynx after removal of the parotid tumor. Next we see xylography of the parotid duct. This is a radiological procedure done to visualize the patency of the parotid duct. Herein, radio-opaque dye is injected through the papilla of the parotid duct, which is opposite the second upper molar tooth in the oral cavity. The dye passes through the parotid duct and an X-ray is taken to see whether the parotid duct is patent or is blocked because of any parotid calculi which are lodged in the duct. Blockage of parotid duct again can be because of a calcified deposit called as a xylolith or a calculus. Fraze syndrome, also known as gustatory sweating or auriculotemporal syndrome. Penetrating wounds or post-surgery in the parotid region could damage the auriculotemporal nerve and the great auricular nerve. During the process of healing, if the secretomotor fibers of the auriculotemporal nerve join the great auricular nerve, then this will lead to sweating, warmth and redness over the parotid region as a result of stimulus by smell or taste of food. Thus, in such patients, characteristically, while eating or while smelling or tasting the food, there will be sweating on the region of the parotid gland. This is the Fraze syndrome. We now go on to see some of these pictures. This picture shows us acute parotitis of the child. This is the same as the case scenario which we had seen in the beginning of the class. It shows swelling around the parotid gland with elevation of the ear lobe, and this is going to have characteristically pain during chewing or meals. The pain is going to stop after the meal is over. This is acute parotitis in a child. Similarly, we could have acute parotitis in an adult with swelling and inflammation of the parotid gland. The next picture here shows us bilateral swelling of the parotid gland in a child, that is bilateral parotitis. Another swelling here seen as a parotid abscess. And finally, an image which shows us a parotid tumor which is seen to raise or elevate the ear lobe, a large swelling related to the external auditory meatus, a fast growing or a slow growing tumor of the parotid gland. Thus, we have gone through the entire parotid gland. We started with a case scenario, then we went on to see the introduction, the situation, the size, shape and measurements of the parotid gland. We went on to see the capsule, wherein here we studied the true capsule and the false capsule. We went on to study the morphological features of the gland, the apex, the four surfaces, that is the base or the superior surface, the superficial or lateral surface, anteromedial and posteromedial surfaces, the three well-defined borders, the anterior, posterior and the medial borders. We saw the relations of all these structures. We then went on to see the structures which pass through and through the gland, the three predominant structures, that is the facial nerve, the retromandibular vein and the external carotid artery. We later went on to see the blood supply, lymphatic drainage and the nerve supply of the gland, and finally we went through the various applied anatomy aspects. We have also understood the case scenario, the symptoms which are seen of the case scenario and how the diagnosis was arrived at. So, that completes the entire gross anatomy of the parotid gland along with the applied anatomy aspects. Thank you.